Today we have Taylor Cleveland, who is a clinical assistant, to talk to us about her career. Thank you for joining us, Taylor.
Yes, I'm happy to be here.
Thank you. Can you tell us what a clinical assistant is and what they do?
Yes, so I'm a clinical assistant, and each clinical assistant in each department is a little different. In my specific department, which is anesthesiology, we have 5 different areas that we work. So each area that I specifically work in, I work in pre-op, which is so you come to us before your surgery, you meet our anesthesiologist, and they had to just clear you for surgery to go under anesthesia. I also work in the pain clinic. So obviously people come in who have pain, and we try to help them. I also work in a different department. It goes along with our pain department, but we do like injections, ablations, surgeries, all that kind of stuff to help with their pain. So that kind of goes together. I work in outpatient surgery. So that's a lot of cataract surgery. We do like mouth surgery, so wisdom teeth, a lot of people know what that is, and bone marrow, stuff like that. And then the last one is palliative care, which is people that are going through a hard time, usually like they're going through chemo or cancer stuff, and they come to us to help them through all of it. So in my job title, we schedule patients, we room patients, we do a lot of recept stuff. So I'll kind of go through them. Scheduling, obviously we schedule patients' appointments, upcoming appointments that we have, or into different areas. Rooming, we do vitals, so taking the blood pressure, height and weight, pulse, oxygen, what else? I think that's it for that. Going through their like meds and allergies, making sure that's up to date. Going through if they have like any implants in their body, devices, we make sure we have that on file. We go through their pharmacy to make sure we have that on file. So when we send medications, we take it to the right pharmacy. We also work with, like in the pain department, a lot of like pain scores where it's at, so the provider knows. So pretty much just getting them prepped for our providers, our doctors. And then the last job that I do is like reception work. So going through like insurance stuff with patients, going through like questionnaires and forms with them, kind of doing that kind of stuff. But yeah, so that's kind of what I do.
And how long have you been in this role?
A little over 2 years now. Yes.
So did you get an education degree to get you that job, or how did you get started in this role?
So when I got out of high school, I didn't really know what I wanted to do. So I took a lot of gen ed. So, I mean, I had a lot of like anatomy done and a lot of biology classes, math, all that stuff. But then I did take a clinical assistant class out at RCTC in Rochester. You don't need that now. So when I first started, you did need that. So I did take it, and obviously that helped me get in. But now if you're applying there, you don't really need that. I mean, they prefer it, obviously, but yeah, you don't need it. It helped me, I think, though. I would recommend it, but yeah.
And so you said in high school you weren't really sure what you wanted to do. So was it those classes that helped you figure out your pathway, or how did you know then that that was the class to take and to go into that career?
I wouldn't say that. I honestly, coming out of high school, I wanted to work in the medical field. I just didn't know what. So that's kind of why I got this job. I just wanted to start somewhere, and I think it's a good starting job, honestly. And it's showed me how many other jobs are out there. So I would recommend it. I mean, there's so many jobs out there that you don't even know about. And so I kind of just wanted to get my foot in the door and see what else was there. So I thought it was a good starting place, but I still didn't know what I wanted to do once I got the job. And now, like after working there for a bit, I do know what I want. But yeah, it's helped a lot.
And you mentioned you go through a number of different departments. Is that normal for a clinical assistant to do that, or is it that one would usually stay within a certain department?
Yeah, I think it's kind of different in every department. I know other departments though that are kind of like that you kind of move around. My specific one, I think, is a lot. I don't know if it was just the one I picked or what, but I kind of like it though because every day is different and you don't ever get bored. And yeah, you don't do the same thing every day, so it's kind of nice.
What would you say is one of the benefits or reasons that you stay in this job? Like, what makes you want to continue every day outside of it being different? What else gives you a perk of wanting to stay?
I think the patient care for sure. It's amazing, like how much you can put an impact on someone's life, honestly, working this job. I mean, even the littlest things to a big thing. I mean, you go home and you just feel amazing because you help someone out that during your day, your job. So it's really nice.
What would you say would be a starting pay for somebody in this role? Just a ballpark if someone
Yeah, I
coming out of high
think
school.
I think starting out, I think it's 19. So it's pretty good. I mean, coming out of high school,
Mhm.
you starting out that, and like I said, you don't need to take that class. It's not necessary. I mean, you don't need it. It's not required. So I feel like it's pretty good. And then every year we all get raises every year. And it also depends on your experience, obviously, too. So like I said, the class would help, or if you were like a CNA or something, that would help. So, or any patient care, honestly.
And you mentioned like doing some vitals and oxygen and blood pressure. What, where did you get that training, or how did you learn how to do those tasks? Is it something you'd learn on the job if someone took that job?
Uh, so like all my vital signs I did learn in that class. That's why I would definitely recommend it. If you don't though, they do offer it when you start there. They offer classes when you first like are a newbie there. They offer classes for vitals. A lot of like the computer work that we do, kind of that stuff. But like meds and allergies, we did have to take a class, but it's kind of like on the job training. I mean, if you don't know it, like any job though, if you don't know it, you pretty much are there to learn it and you get taught and then you just do it. It's your regular job then. You just get so used to it. But yeah,
Perfect.
I mean, you're never just thrown in and not trained. So
Yeah.
yeah.
What about soft skills? So you mentioned in high school the biology and the math. What
Mhm.
about interpersonal skills, problem solving, things like that that a person should have to go into this career field?
Yes, I would definitely say problem solving is huge in our area. Um, Teamwork. I mean, you had to have teamwork working there. I couldn't do it without all my coworkers. And even not just my coworkers, but the nurses, the providers. You work along with a lot of people. So you definitely need teamwork skills. A lot of responsibility. I mean, you're in charge of the patient right when they come in and right when they leave. So that's huge. Um, I would say probably communication is huge. And the biggest thing I think being a clinical assistant is your empathy, your empathetic skills. I mean, people are coming there not happy to be there. I mean, they want to get help, so it's huge to be there for them and help them through their process.
Yeah. And a very caring personality and very
Yes.
passionate, I see that you are. So that's
Yeah.
amazing.
Yes, very.
Do you see this a job that you'll be in for a long time, or do you see opportunities that you want to go for?
Yeah, as of right now, I'm actually trying to go for nursing, but I would not have known about wanting, I mean, obviously I knew about nursing, but I never really thought of me being a nurse just because I don't know why I never thought that. But this job has honestly showed me how much I do want to be a nurse. It's like so rewarding, and nursing kind of goes more in depth. So if you wanted to do something more in depth, I mean, nursing is kind of like this, but like I said, more into the patient care and all that. Um, I wouldn't say I would never do this job for the rest of my life. I mean, I love it, but I just want to go I want to keep going. And that's the nice thing with this job is you can, like, a lot of people start out at this job, kind of know what they want and see the other jobs out there, and then they go. And I mean, yeah, it's a good starting job, I think, for sure.
If a student were similar to you in high school, thinking, I'm not sure what I want to be, but I kind of want to help patients, what classes should they take in high school that would benefit them to go into a career like this?
I would definitely say anatomy, because you can never not know enough of the anatomy. There's so much to learn. I mean, I've taken anatomy in high school, anatomy in college, and I'm still learning. Also, probably like a computer class. I think I took a computer class in high school, and that's helped me a lot. All the different, and there's so much on that computer or tablet that helped. I would say, yeah, anything like biology, all that kind of stuff. That has helped a lot. Even chemistry. I hate chemistry, but it's helped.
Yeah. And lastly, as we go to wrap up here, for just a 16, 17-year-old watching this, kind of unsure what they want to do, what advice in general would you give them for looking at their career and their futures? Do you have any thoughts about what they should be considering?
I would say explore. I remember going out of high school and I was so scared because I didn't know what I wanted to do. And I got this job and I almost felt like when I first got it that I was stuck here for some reason, and I don't know why, just because it's your big job that you finally got. And I realize now that you're not ever stuck no matter your age or where you're at. I think you should always explore and see there's so many jobs out there that, I mean, it's crazy that you don't even hear about. And I think exploring them and seeing the different areas, and I mean anywhere, not even in a clinical setting, but everywhere, it's amazing what they have out there. And yeah, just don't ever feel stuck, and don't ever like just settle. Keep going until you truly know.
Sounds perfect.
Yes.
Well, thank you so much for your time today, Taylor, talking about a clinical assistant. I know that's a job that I've been to the doctor several times and didn't know that that was a role. I just assumed it was part of the nursing and that person was a nurse. So I appreciate the training. Yes. And we thank you for your time.
Well, thank you. I appreciate it.